When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
How did one CHSLD manage to have no cases or deaths of COVID-19? Let's find out by speaking to our next guest. Chantale Bourdeau is nurse manager at Lachine Hospital and Pavillon, Camille, Lefebvre. Hi, Chantale.
Hi, good morning.
Thank you so much for joining us. Pavillon, Camille, Lefebvre, CHSLD, and it's in Lachine, correct?
Yeah, that's right.
And no cases, no
cases.
deaths of COVID-19.
Not at all, yeah.
Take me back to March when all this began and, what was going through your head at the time and what you put into place and what do you credit with that unbelievable record now that we've been through this 3-4 months here in Quebec?
Well, I think that at the beginning in February, when we started to hear about what's going on in the world, and when it started at the beginning of March, we sat down like the MUHC has been done with the emergency committee, and we sat down all the manager from all services, and we had one objective that we want to protect. The objective was to protect the patient, the resident, and all the health care worker from that disease. So what we did was really put in place a team in infection control, and all the people had to follow that. We have a filter center at the hospital and also at the pavilion. So all the healthcare workers were filled at the beginning of their shift. And during the shift, if they started to have any symptoms, they were sent to the dépistage tent to have the test done, and they were sending home. So as soon as they have symptoms, we send them home for up to the time that they have the results. So the contamination was very low.
Chantale, listen, I have to say, I've been reading about your CHSLD and the work you've done, and I keep hearing really great things about you. So, and your decision making and some of the things you did. We, in Quebec, throughout the province, we saw so many stories about staff movements and staff going between multiple institutions, that kind of stuff. At the start, you did a couple of things different, right? With people returning back from March break and with staff movements. Can you get into that a bit?
Yeah, when they were coming back from their vacation, we decided to let them home for 2 weeks just to make sure that they didn't develop any symptoms of the disease. And also, we started at the beginning in March to stop the healthcare worker to come from the side of the hospital or and go back to the pavilion. And we stopped also the healthcare worker going from one unit to the other. So in French, on a segregé, the healthcare worker, they were on one floor only.
Yeah, you isolated them or segregated them.
Right.
Yeah,
that's right. And even there were some healthcare workers sometimes working on another hospital, so we stopped that. We called the manager over there and saying if they can take them for a full-time or not. If they were not able to take them for full-time, we took them. We also have we put over personnel for the housekeeping just to make sure that all the eye touch were disinfected everywhere. We stopped the employees to take, for example, the stairs. We want them to take the elevator only because I know that we can disinfect the elevator, but we didn't have enough personnel to do that for the stairs. We also show a video to everybody to how to put the protection for the mask, so the donning and doffing. So they had to listen that video every morning. They didn't have any choice.
Wow. We're with Chantale Bourdeau. She's a nurse manager at Lachine Hospital and Pavillon Camille Lefebvre. And that's CHSLD, 0 cases, 0 deaths of COVID-19 since the start of the pandemic. Chantale, I also heard that you didn't use these third-party services, right? Like these placement agencies for employees.
No, we didn't have that in Lachine and at the MUHC. We don't. So that's really helping because it's our employees that was always meet with the nurses specialized in infection control. So we didn't have that on the hospital side or Pavillon.
Chantale, when all this began and then around you, you see CHSLD after CHSLD and then another and you hear about the horror stories, places in Dorval. When you started to hear all these things and you hear about how the positive tests in all these other institutions, what was going through your mind?
Well, we were very sad to see that because it was not very a good moment for my colleague in those CHSLD. Unfortunately, I don't know how they managed that because I'm not working there. But the main concern was really when we see that happen, it was to put more energy to protect the pavilion because the pavilion is part of the hospital. So we even have a mechanical barrier with security guards. So because sometimes the nurses has to come from on the side of the hospital to bring blood tests or to go to the pharmacy, and they were obliged to pass by only one side on the rez-de-chaussée, and we had a security guard over there to make sure that they were washing their hand properly, that they were wearing a mask, because at the beginning we have the filter 10. Everybody has the obligation to have a mask. Yeah. To enter the hospital or the pavilion because we are very, very small and we were not able to respect the 2 meter between healthcare workers. So everybody, and even today, they are obliged to wear a mask all the time.
That just makes it, all the more impressive when you add all those details in, Chantale. I have to ask you, has the government, has anyone from the health ministry or the minister of seniors, has anyone come to you and say, I need you, Chantale, you need to write us a report of how you did it so everyone else can do it just like you. Has that happened? Has anyone reached out?
Well, we have those agents from the minister that come to visit the CHSLD, so they know exactly what we did. And they came 2 or 3 times, if I remember well. So they came to see what we did. Yeah.
Do you think they've gotten the message? Do you think they've learned? That because I'm just thinking about September, October, and they talk about a second wave, right? And I want all the CHSLDs to be in the position you're in, right? Come September, October. Do you think they've gotten the message of your secret to success here?
Well, I cannot tell you about that. I just know that a lot of things have been done with the minister lately. So.
All right, Chantale, listen, I just want to say I'm sure everyone who's listening to us who has a loved one at Camille Lefebvre just wants to thank you a million times over for your hard work and how you handled the crisis. It's a shining example, and I thank you for coming on the show.
Well, my pleasure.
That's Chantale Bourdeau, nurse manager at Lachine Hospital, and Pavillon Camille Lefebvre, one of only 3 public CHSLDs in Montreal spared by COVID-19. The others were the Father Dowd CHSLD and the Dante CHSLD. Only 3, along with Camille Lefebvre, spared of COVID-19. An exceptional story. My thanks to Chantale Bourdeau.